Oh my God.
I think
Okay,
this is the perfect start for us, honestly. This is so us.
this is on brand. All right, let's get in. Um, Welcome back, everyone. We're going to do a really fun episode today. We're going to talk all about sex, and it's going to be awesome. And the best person I could think of to talk about this with you guys is my sex therapist, Sara. Sara, welcome to ICU.
Howdy, everybody. Hello from my car. I'm on a road trip currently. I'm in Albuquerque, New Mexico. So I'm going up to the hot springs tomorrow. Gonna have a great time. So I figured this is the most on brand I could possibly be, is being in my car and doing a video call.
Yeah, you're literally either in your car whenever we meet or you're on your couch eating cereal or something. I don't even know. It's very
I love it.
unconventional, but like that's what I love about you.
It works. It works. You're
It
always very
works.
put together. I feel like we're like a good duo.
We sure are. So, yeah, do you just want to kind of briefly introduce yourself to my audience?
Cool. Yes. I'm Sara. I'm based out of Pennsylvania. I do therapy. I have my own private practice. I have a few clinicians who work with me now. I mainly do individual therapy, although we do like couples therapy and all that stuff. I'm licensed in a bunch of states, so I do a lot of practice with people across the country. And generally, I work with a lot of different sexuality topics, pretty much anything that you can think of when you think of that word. But I would say my main focus is working on or working with people with chronic pelvic pain and working with people in the queer community. Those two buckets comprise like most of my caseload right now.
Sweet. And you do have like a personal connection with that, like the
Oh yeah,
pelvic
of
floor
course.
dysfunction?
Yeah, you know what? If I could tell a little story, because I'm a babbler, although I guess we
Babylon.
call that a yapper nowadays.
We're
Trying to get
just
with the
gonna yap
lingo.
a little bit and just
Yapper.
everyone, if you don't like cursing, you shouldn't listen to this episode because Sara is a
Did
sailor.
I curse already? Oh God.
No, just a
Okay, great.
warning.
So let me say this as an aside too. I curse a lot because I worked with the state for 3 years with convicted sex offenders, and like you had no street cred if you didn't curse in that job. So now it's just uncontrollable. Fucking love that job. And uh, wait, how did okay, pelvic pain. So it's interesting. So I got a counseling master's, and that's like my licensable degree that I use to practice. And then I enrolled in, at the time, the only accredited program in human sexuality in the country, which was Widener University. And when I was going to do that, I met like a Widener grad who ended up being my clinical supervisor when I first joined a private practice. And she specialized in working with chronic pelvic pain. So working under her was like so helpful for me to get all of the foundations. She's a fantastic practitioner and provider. And so I kind of got a lot of the framework from that. And then I was running my first pelvic pain group that I ran because a lot of my clients, they want to talk to other people who deal with this and who manage these conditions. So I got a group together and we were all meeting, and I had like guest speakers, and pelvic floor PT came in and they were talking about it. And I was like, whoa, wait a minute. This sounds like I had a lower back injury, right? I fell down the stairs and like totally fucked my back up, and I was still dealing with like a lot of chronic pain at that time from that. And I was like, oh, maybe this could be helpful. So I went to pelvic floor PT, and they did like the eval, and they were like, oh, should we do like the internal eval? Um, and I was like, oh, fuck yeah, get in there. Like, of course. One, like, it's a new experience.
I feel like
And
that's
two, I'm
not a
like,
common response.
I know. I'm a little abnormal. I wanted to see what it was like too, because clients go through this. So I was like, go for it. Like, explore, have fun in there. And they like touched around in there and did like, the clock. And I was like, holy shit, some of this is really fucking painful. And they were like, yeah, you have like pelvic floor dysfunction. Your muscles are like super duper tight. And I didn't know that that's what that was, right? I had had pain with sex before, but I thought, silly. I thought my partner was well endowed. Oops. Actually, it was pelvic dysfunction.
Oh my God.
So PT really helped with that. And that was like really interesting because I was like, oh wow, okay, this is me too, which I guess isn't surprising with hindsight, but it was like funny that I like came to that discovery after having done this work for a while.
Yeah, I can imagine that was an interesting discovery.
right?
Yeah, I'm trying to think of my journey, and it was kind of similar, but I mean, I
Really?
guess I did the PT before I got into this particular field, so I guess it's a little bit flip-flopped, but still somewhat similar.
Was it a surprise for you when you went and they did the eval?
Like, what was the surprise that you're asking about?
Like you said your journey was similar, so I guess I assumed it was the surprise perhaps, but maybe it was something different.
Yeah, I mean, I was convinced that my bladder was the problem, and then for them to tell me, oh, it's your pelvic floor muscles, and I had read about that previously, but I was like, no, no, that's not me. It's my bladder.
Yep.
And
Yep.
then I just had like this whole like my mind was blown, and then that just put me on a whole different trajectory, and here we are today. So yeah, I can relate to that a bit.
Yep, makes sense. I get it. Also, I'm gonna try not
Yes.
to ask you questions because I was just realized I'm like, how did you feel? Sorry.
No, no, that's totally fine. I guess I should probably set the stage next for like how we met each other. So I mean, the past couple of years, actually not the past couple of years, past like 5 to 10 years, I struggled with low sex drive, and I had doctors who would tell me, okay, you have anxiety, like maybe it's medication that you're on, like we don't really know, but you could try going to see someone that specializes in this. And before seeing you, I saw someone else who I just like didn't have the greatest experience with. We just didn't vibe. It wasn't a good fit. You
Right.
guys are absolutely total opposites of one another. And I'm glad that after that experience ended, my last IC doctor, Dr. Eckenberg, he referred me
Mm,
to you because we're all kind of local to the same area. And that's
right.
kind of how I started seeing you and why I started seeing you.
Right.
So we've been working together for what, like a year now?
Wow, time flies.
Time
And
flies
I
when
agree with
you're
what you
having
said. Like
fun.
you learn this in therapy school. The most important part, honestly, for positive patient outcomes in therapy is rapport. And so it is very common to see a provider and feel like you're not making headway or like and you might wonder if something's wrong with you or what have you or keep giving it the old college try. But I think rapport is like the number one correlation with like positive outcomes in therapy. So I get why you want to find someone that kind of like matches your freak a little bit.
Well, yeah, you have to feel comfortable disclosing certain things
Yeah.
to the person. And I just didn't feel that sense of comfort with the last person. And also just with my general therapist that I was seeing, like I just did not feel comfortable doing it. So you make me feel
Yes.
very comfortable. So good job. I'm sure the audience can understand why.
I get so many clients coming to me and they're like, "Oh yeah, I want to see you for the sex thing because I can't talk to my therapist about it." And that kind of blows my mind, right? But I understand that's just me because I'm like that sex is such a huge part of life. Like it's so important that some therapists like might create like an uncomfortable environment around it or feel discomfort in themselves when talking about it, which again is so valid, right? But like I get when you do this work and it's like kind of touchy, you want to see somebody who gets it or who isn't going to be a dick about it.
Hmm. Totally. And I'm kind of thinking about my audience and what they're struggling with. And I think one group of people probably have pain with sex, and then that kind
Hmm.
of throws them into this pain fear cycle. And then we have another part of it who has like low sex drive, low libido, and then I'm sure there's a lot of people that just have both of those,
Right.
which absolutely sucks. I've been there. So I thought it would be great for us to kind of dive into that a little bit more if that's cool with you.
Yep.
All right. So when you see somebody who's coming to you for low sex drive or issues with that, like where do you even start? Like what is going on with those people?
What a broad question.
I know when it came out, I was like, oh, that didn't sound great, but you know what I
I'm
meant.
gonna me though, I can yak, right? And I think I'm gonna rant about this a little bit because I'm also like frustrated at our culture and society where like what the fuck is low sex drive or low libido, because that's low is a term that we use in comparison to something else, right? So I think there's this norm that exists in our culture that's like really propped up by um like patriarchal society and our puritanical culture, at its roots, that says like well, okay, let me take two. Like, basically, it says, oh, the way that men want to have sex, the way that men exist, the way that men feel desire, the way that men's bodies operate, even medically, right, is the norm. And so, like, a female presentation is always atypical. And so, when we look at female sex drive, there's this implication that we're always and constantly comparing it to what we believe male sex drive to be. And we live in a culture, too, where male masturbation is synonymous with pornography use, and that is like a whole thing that kind of like warps the ticket too, because what is real sex anymore? So, I really believe, frustratingly, that low libido is a moniker that exists because we live in this culture and society. And also, like, what the fuck does that even mean, right? Um, sure, maybe it means I feel lower sexual desire than my partner does. And I think that that is like an important distinction to make too, is like, the although I don't like it also because then it just kind of blames that individual, which is maybe something that you felt. It really feels like the issue, if we're talking about libido, is if there's a disparity in libido between the two partners. So if one partner wants to have a certain amount of sex or a certain type of sex and the other partner doesn't, that disparity is the issue rather than the low libido partner's fault. Because again, right, societally, we don't say like, oh, well, let's castrate high libido people so that they meet their partner where they're at. Like, it's just kind of fucked up and weird when we talk about libido in general. So like, I kind of start with that, I think, to go back to your question, which is like, I feel like there's a lot of like guilt and shame and messages that exist already around libido that clients are coming through the door with when they meet with me, that I like work hard to understand and take a pulse of, and then work on uh like zooming out of those scripts, I guess, and like helping to acknowledge and address if there's any shame or self-judgment or anything that arises from that.
Yeah, those are things that felt definitely on my personal journey with all of this.
Right.
I'm kind of thinking of, okay, the people who maybe developed pelvic pain, bladder pain, symptoms similar to that, like maybe later in their life, like maybe like 30s, 40s, and they've experienced a time where they had a certain frequency of sex or
Right.
they had the desire and then all of a sudden they have this pain and now okay they don't want to. So can you
Right.
talk about like what's going on in that scenario?
It God, I have so much to say on this too, right? Because there's so many factors. Like I think about, I'll speak to myself personally and then maybe more broadly too. Like, I look at the way that I had sex earlier in my life as well, and it is different than the sex that I have now in my mid 30s. And I think like, yes, I can attribute some of that to bodily changes, etc., but also like culturally, I think the way that I've felt about sex has shifted. Whereas like previously it might have been like, ooh, I'll do anything, or oh, let's do what you want, or whatever the fuck, right? I feel like there was this cool girl mentality that I grew up with under like that third wave feminism of like, wow, I'm down, I'm game, oh my god, I'll watch sports. Like, that kind of made me feel the need to comply with like male gaze and with like the way that society told me that I should have sex, because there's a script to sex, right? You and I can name it even if we've never taken a class on it. It's like, oh, we feel a lot of desire and we make out and then maybe we like do a little bit of oral, but not too much, right? We don't want to like do that too long. And then we have P and V sex for like a socially appropriate amount of time. It can't be like too short, can't be too long. And then the guy comes and it's over. Right, that's it. So that was like the sex that I was having. And I had a lot of that sex. Like, that was kind of just the script. And then, you get older, I think, and it kind of changes. You have a lot of sex where you're like, man, does this guy, has he ever gone down on anybody? Like, am I ever going to orgasm? And like that becomes a little less desirable over time, maybe, let
Mm-hmm.
alone if you have bodily changes or challenges that come up, if you have kids, god forbid, anything like that, like especially pelvic pain, OAB stuff. Of course that's going to affect your libido, but I also think that there's a lot of factors there too where, when you get the opportunity to zoom out and kind of look at your life and the sex that you're having, you might determine that a lot of the sex that you've been having was not really for you. And I think that that is a thing that people in our age group kind of are coming to right now, as part of like a developmental stage and a part of like feminism too. Um, but anyway, okay, to speak more broadly, I guess, about OAB and pelvic pain and libido, my answer to part of that question anyway is like, if P and B sex is painful for somebody, why would they want to be having it? Why would they desire it? Like, low libido or whatever you want to call it is like an absolutely reasonable response to not wanting to do like something painful. Just like if
Right.
I eat sushi and I throw up, of course I'm not going to want to eat it.
Sarah,
Like,
why are you
sorry,
bringing
no,
up
sorry, I was like, fuck. Shit. No, my tummy hurts. How about that? Oh god, I'm gonna blush now.
Oh my god,
Oh, my bee.
no. We're gonna have to edit out so much of this random laughing, but it's fine.
Please don't
Um,
edit this out.
okay, I won't. But I mean, I think it's important to highlight the effect of pain on our nervous system
Yes.
and tie that
Yeah.
all into sex because like you said, if you're having pain,
Yeah.
why would you want to have sex?
Absolutely. And then if that creates a nervous system activation, right? If you call it the dial turning up, where even then the smallest stimulus, like the tiniest little bit of static, is deafening because the volumes turn so fucking high, like that avoidance response becomes very strong. And that's just your nervous system doing what it's supposed to do, right? Something bad is something scary. We're going to avoid it, or we're going to dread it, or we're going to like really try to make every excuse in the book to not do it. And I think that's completely valid. Um, and also, like with that nervous system activation, when you're in fight or flight, a lot of people, myself included, right, tense my muscles up. I clench my jaw, I clench my pelvic floor, I ball my hands into fists, you name it. And that is going to make like a more hypertonic pelvic floor and increase pain. And then it's in this positive feedback loop that's very hard to get out of.
You're reminding me of an incident that happened yesterday. I I got like a half-inch splinter in my foot
Oh,
from just
what?
like our flooring here. But anyways, my dad said, "Don't go to urgent care. I will get it out for you." So here's my dad with like the freaking cuticle cutter, like
Doing surgery on your foot?
digging into my foot, and the whole time I was like, oh my god, this is gonna hurt. This is gonna hurt. It hurts.
Yep.
Ouch. Like I definitely made it way worse, but obviously this is just a protective mechanism. Like we're bracing for it.
Yes.
And I think that, kind of is similar to what's happening with sex. And for me, growing up with bladder pain, I didn't know what sex without pain was like. And
Right.
also, I'm telling my parents not to listen to this. I don't even think they listen to my podcast, but I'm going to make sure that they do not hear this because, like, we just don't talk about that stuff. Anywho,
Hey, that sounds like a factor. Anyway, continue.
hey, that sounds like something we should talk about in therapy.
Yeah.
But, anyways, I just never knew of sex without pain. So for me, that was normal. That was something I was like, oh, this is like the norm. I need to push through it. You see
Yeah.
on TV and movies, it's like the first time someone has sex, it hurts. And they're like, that's normal. But now I'm learning that it's not.
Right.
So
What
interesting.
what do you think of the not normal? Like I feel like there's like a lot of feelings that come along with that too that aren't always great. Like but oh sorry, I'm asking you a question again.
I didn't even know what you were asking me. So if you want to ask it again, you can.
I wonder, I'll just talk for you. I like hear from a lot of people too then, there's like this, like if we're talking about deprogramming going through this too, right? Just realizing that this isn't the way sex should be. It's not like, oh my god, thanks, I'm cured. Like in the same way that people, if they grow up like with family dynamics around sex or like religious repression around sex or whatever, just getting a ring on your finger and having it be like, oh, God said you can bang now, doesn't make your pussy like magically open up, right? So like I feel like part of the like process of going through this too is dealing with a lot of the negative feelings of like resentment or like lost time or self-judgment or whatever, or judgment at the system. That's me, right? I feel like a lot of resentment at the system. Like that stuff has to be worked through too, and then it feels like the light at the tunnel gets a little bit further away too.
Yeah. I think working through this for me has been like a multi-factorial, whatever that word is, approach because
Yeah.
I needed to work with you to really like strip down, okay, what's underneath all of these feelings? why are we feel or why am I feeling like I don't have the libido that I want per se? And then you always
Mm,
challenge me by like, well, what does that mean? What do you want? And I'm like, oh my God, I haven't even thought about that. But anyhow,
right?
the other parts of it for me that have helped me get to a place where things are a bit better is in terms of my bladder issues and my pelvic pain and stuff was, getting that chronic stress minimized. It's still
Right.
there, but it's a work in progress. So that has been huge.
Right.
Getting my pelvic floor addressed through PT has also
Yep.
been huge. And then just like general healthy lifestyle habits, like staying hydrated, eating a variety of food, um, just like living and not restricting myself. Like those are all of the little pieces of the pie for me that have helped me like keep progressing through time.
I like that, and I find that interesting too because like so much of people that go through chronic pelvic pain or OAB or like any other chronic health condition too, there's this period I think of like the wanting to figure it out, very well intentioned, and also the grieving process where your bubble gets so fucking tiny. It's like, do I have to do an elimination diet of everything? Oh, I can't drink any water at all, or I might, have urgency or frequency. Oh, I can't do anything. I can't wear these pants anymore, these underwear. I can't sit in a chair. I can't, and you know, overcoming that is really hard. And I appreciate you saying that that was like a part of your journey of healing and, you know, just broadening that bubble.
Yeah, no, literally, like with my clients, they're like, I had someone recently, she's in her early 20s, and she was like, We're celebrating St. Patrick's Day this weekend. Like, do you think I could have a singular drink? And I was like, I mean, live your life. I think you can have more
Right?
than one singular drink. Like,
Right.
I don't want you to miss out on these times. Like, obviously, like within moderation and alternate with water, but like, go live. I feel like if you
Right.
restrict yourself, that's more stress than if you actually had consumed the potential trigger. Like, there's not even a guarantee
Yep.
that these things are going to trigger us, but doctors have labeled them as bad.
Right, and I think you're describing too is a checking behavior, which I know you're familiar with, and what you kind of described too with like, getting that splinter out of your foot. A lot of the coping mechanism too of like nervous system dysregulation involves checking behaviors where you're like checking on what you're drinking, checking on what you're eating, checking on if you're guarding your pelvic floor, checking on like all this different shit. And I was like, I had this experience last night too. I had like a lot of checking behaviors when I went to get a massage because I've been driving for freaking ever, and so I like went to this random ass shady ass spot, you know. I don't know the people and they didn't really speak any English. I was like, I'm a baby, I'm a little scared. Can you go gentle? And they had no idea what I meant. So like this person was like beating the fucking crap out of my hamstrings, which was great. But then they're doing my back, and I have that injury in my back, right? So I have these checking behaviors too. And when they're really like getting the fuck in there and doing some heavy duty stuff, I find myself like tensing, and then I'm releasing, but then I'm tensing again, and then I have to. It's like it's an ongoing process, I think, of noticing this and like allowing your brain to like. It's kind of like, hey, buddy, like I appreciate you're doing me a solid, but like we're gonna be okay, and that is a big journey to go through, especially if part of this grieving process too is feeling resentment towards one's own being, one's own body.
Yeah. We've been talking about that a lot lately in my
Yeah.
program, especially as we read the pain reprocessing therapy workbook. They talk a lot about, compassion and, giving yourself grace because it's literally just trying to protect us.
Right.
How can you get mad at something? We're going to picture it as this like really cute thing that's just trying to protect you. Like it's just doing his best. It's a
Yep.
he, apparently.
Love it. Love genderqueer bodies. Big fan.
Oh my God. Okay. So, do you see a lot of people like in the same scenario as me, like symptom presentation of like quote unquote low sex drive, pelvic pain, symptoms like that?
Yeah. There's this really interesting constellation of symptoms that I see in chronic pelvic pain patients or like people with nervous system dysregulation. I see I mean, obviously, this isn't scientific in nature. There's no correlation study here that I'm using to draw from, so this is all just hearsay. But, um, I would say chronic pelvic pain, chronic muscle tension, nervous system dysregulation, OAB stuff,
What about,
TMJ.
I was just going to
Go
say
on.
TMJ.
Yep, right. So correlated. Um, and like a lot of like anxiety, even OCD, I would say, especially like scrupulosity, morality OCD. I see that a lot. And then like some odd, like I'm not saying odd here where I'm like, oh, it's odd, but like stuff that maybe you wouldn't even think is correlated, like emetophobia, which is a fear of vomiting, and some other phobias too. um it's just like a lot to it, I want to say. And like neurodivergence, ADHD, autism, maybe, like there's a lot of like symptoms that kind of coexist that I'm like really interested to see the science tackle as like studies continue to be done on all this and correlations between them.
Yeah, it definitely feels like there's something there because you literally named like everything that I have been diagnosed with. And I'm curious to hear my audience after they listen to this. Like, are you guys resonating with this? Have you had the same diagnoses? Like, that's so interesting.
Right. And I think I mentioned this to you, like, when I saw Dr. Eckenberg, and I just met him as like a colleague and we are kind of talking shop, and I like gave him brief like little thing like ditty about my life or whatever, or like my experience with pelvic pain, like I said earlier. He was like, oh, you mean, he was like kind of shocked that my pain isn't worse than what it is. He was like, oh, it doesn't hurt all the time. And I was like, no. And he was like, wow, all of these things sound really like you should be in a lot of pain. And one, that was like horrifying to hear. Because
Well,
like I worry that my symptoms will transform into like vulvodynia, vestibulodynia, or
if
any.
someone said that to me, I would literally think myself into having those symptoms.
See, and I hear that, and you're working on that.
We are. We are.
And I think I credit like my brain. There's just some natural resistance in there, I think, to overthinking. Like I think I have anxiety, but it's all in my body. I don't really have any anxious thoughts, thank fucking God. um and I think it's because of like the framework of how I structure thought in my brain, which is really weird to talk about. But this is the work of therapy too, is like kind of working with the way that your brain structures thought. And if there's a fucking paved 6-lane highway of anxiety and fear and guarding behaviors around like my pelvic floor or whatever, it's very ugly and unattractive to have to me come in and be like, all right, well, let's bushwhack through the bushes here and create a little fucking walking path instead of taking this quick 6-lane pathway. It's a lot of work, man.
Yeah, for sure. That example totally lost me.
Oh, sorry. I okay, with neuroplasticity, the way that our brain thinks, there's actually like neuronal connections between certain aspects and areas of our brain that form. And so when we're doing therapy and other work to kind of change our patterns of thought, like I have sex and it's painful, and if my original thought is, "Wow, I'm worthless, no man's ever gonna want me," that goes pretty strong, right? And I'm like likening that to a 6-lane highway, right? Now, if you go to therapy and you've been doing this knee-jerk reaction of I'm worthless, I suck, I'm never going to find anybody, nobody's going to love me, what can I do, whatever, I'm always going to be in pain. Part of the work is kind of noticing that you're driving on this highway all the fucking time, of course, because it's the quickest route, because your neurons assemble and connect with these synapses, where that pattern of thought becomes quicker and quicker and quicker, and just more built in, more ingrained. So part of therapy is like pruning back on that by disincentivizing that pathway neuronally, and then like putting in new patterns of thought or new ways to think about it. Of like, I would be a good partner to somebody, or wow, somebody's really gonna love my lasagna, or sex isn't the most important part of a relationship, or obviously it sounds trite, right? But I'm saying I think that's like the bushwhacking process where like we're going through with our machete and like tromping through the woods to try and create a new pathway if we decided not to use the 6-lane highway. And that's an ugly process. It's very hard to undo those ingrained patterns of thought. And quite honestly, it's like doing the PT exercises, right? Nobody wants to fucking dilate. Nobody wants to do like glute exercises. Like I get it, and I get that that helps, but like doing it is unattractive and it takes a lot of work. And sometimes it's just easier to do it in the office rather than go home and have to like pull out your Uber Lube alone in your bed, you know? So
Hmm.
like I think that's the like while one can do this work on one's own, I think that's the value of therapy too, is that you have like a guiding hand helping you and affirming you throughout the process.
Yeah, so true. You could do most of this on your own and getting relief. Like you could do the pelvic floor stuff on your own. Like
Totally.
you could do the diet stuff, like, but like having help and
Yeah.
guidance is huge. I mean, for like to relate it back to what you were saying about like rewiring your thoughts, like we work on that a lot. I feel like, you're like, well, that thought process, like, do you realize, how that's kind of, I don't know, maybe like mean or like you're judging yourself. And then I'm like, oh yeah, you're right. And then I immediately am like, shit, I shouldn't be doing that. And you're like, don't do that. It's like you just have to like notice it at first,
Yeah. You're the
right?
cat and I
And
got the spray bottle. Yeah, yeah.
yeah. Oh my God. Just compare me to a cat. Thanks.
It's hard. It's hard. It's like noticing the way that you think. It's like a mind fuck. Like I think about David Foster Wallace's like short essay called "What Is Water" that he like read at like a college commencement or whatever for liberal arts majors, and basically there's this joke in it that's like, oh, two fish are swimming by and another fish comes by and he goes, "Hey boys, how's the water this morning?" And they keep swimming, and then the one fish says to the other, "Oh, what the hell's water?" And it's like I think we're just surrounded by this all the time. We don't even notice it. Like the way that we even think about life, the things that we think are real, they're not actually real. A lot of this is our creation. Like my worth as a human, for example, is not an objective thing. I can't measure it. But if I'm like looking at aspects of myself, like my weight, and being like, oh, well, I'm too heavy. Oh, I'm ugly. I'm worthless. Wow, I really can't get it together. Like, I've been doing that since I was like fucking 6 years old, you know? Like, that's a really hard thing to undo. And I don't even notice when I'm doing it sometimes. Like when I made a banana bread the other day and was talking to my friend about it. It was like, oh, I put applesauce in it instead of oil so that I can eat the whole thing like this week. And she's like, what does that even mean, Sarah? And I was like, oh God, I'm doing it again, right? It's stuff like that creeps up on you. Then that's okay. Having another person there to kind of be like, what the fuck is like very helpful.
Yeah, it has been for me. And I'm just thinking about all my clients who, regarding like their bladder symptoms, they kind of fall down, like they have those thoughts, but more specific to their bladder of like, really resenting their body
Yeah.
or just like getting really frustrated with it. It's like, okay, we can start doing the nervous system regulation work, but if you're still having that like really negative inner dialogue, like it's really not going to move the needle all that much.
Yep.
So, definitely something to think about if you are listening and you can reflect on, what does my inner dialogue sound like? Do I say some of these things to myself? Like maybe that's something you could work on.
Right. Right? Maybe it's like an occurrence that happens because of all this and is like part of that constellation of the symptom of the problem.
Yes, exactly. All right, let's switch gears because I feel like a lot of people want me to ask you about like dealing with like pelvic pain, bladder pain, symptoms like this. Like you're actively dealing with that and being in a relationship or, being married or
Mm,
whatever. So things are changing not only for you, but they're also changing for your partner.
hmm.
And that can go a bunch of different ways. You can have someone who's really supportive, or you can have someone that is like, what the fuck, we can't have sex anymore. Like, that's kind of sucky. So, what are you seeing in your clients? Like, is there like a common theme that you're seeing?
Yeah. I mean, so I would let me just set the tone here. Right? I think we're talking about cisgender women who are typically in a monogamous relationship with cisgender men, right? So like the sex that they're having is usually P and V, or that's the sex that they're expected to have, right? Is penetrative sex with a penis inside of their vagina. And so like that presents a host of problems. Not that this doesn't trickle into other relationships or what have you, but I think this is kind of the framework that we're discussing, or that comprises a large majority of your population. Um, and generally, yes, the clients I see are women with male partners who then find it very difficult to like understand where they stand in their relationship, or like what kind of sex they can be having, or even what's allowed, especially if they're in the earlier stages, right? And all that guarding behavior is going on, and all that like restricting that we kind of alluded to also. It's very hard to kind of have that shake up in a dynamic, whether even if you're single, right? Like, and like seeking a partner or seeking
Dating,
sex.
dating
Yeah.
with this stuff was not fun for me,
Mhm.
at least. Because it's
What?
like,
Tell me more.
when do you, oh my God, tell me more. Like, when do you bring it up to someone? Is this like first date material, or is this like you need to determine if they're a good person before you drop this little information bomb on them? Like, it was
Well,
tough.
the process of dating is determining whether you want to spend any time with this fucking person whatsoever, and also if they're a good person. So like that doesn't change, right? Um I mean, I'm single and I have like chronic pelvic tension or pain or what have you, right? Like with sex. Um, and I would say for me personally, and I understand I'm not a normal person as evidenced by this entire conversation that we're having. So take it with a grain of salt. But like usually I disclose like pretty early on, or like when we're talking about, not, I don't put it in my bio. I'm not ashamed of it. I don't feel like I have to declare it to people to like prune them out. I don't like bring it up on the first date and be like I think it's the tone of which a person brings it up, where they're like, hey, I'm sorry, but this doesn't have to be news that you're like sorry about, right? Like people have all sorts of fucked up shit in their lives, and not implying that this is necessarily a big fucked up shit, because it doesn't have to be, and it isn't for me. um but like there's all sorts of stuff going on with people that they want to bring to the table or disclose or receive acceptance and love on from partners. So for myself personally, right, I'll bring it up when we're like talking about sex, because I talk about sex, of course, it's my job, like, so that comes up in conversation, or like, and I'll make a disclosure and just say like, hey, like I have like muscle tension or whatever, or like, and I usually just drop it in. It's not that big of a deal, right? Like, but that's because like I'm creating my reality, and that's where it sits in my reality, is just like a little factoid about me. And I've never had somebody have like an issue with this disclosure of mine, although I recognize that happens. Um, I've not had anybody react negatively to it in like a context of like sex either. But I think that's because I do a lot of vetting to partners. Um, and like there's no guilt that exists within me that I feel like I have to like put up with somebody more than I should, or that there's something bad about me, so I might as well put up with negative things that I see in them, right? Like, but so anyway, I guess I'm saying like self-esteem I think is a big part. But as far as like how to navigate this in dating, I do think disclosure is good, but I also think talking about sex before having sex is pretty fun and great. Like, and not doing it from an apology standpoint of saying like, hey, here's the thing about me that you need to know, but rather just having it be like, here's another fact about my life, right? I'm a Gemini. I travel in my car and I'm fucking gross right now. um I like to play video games, and I have really tight jaw and pelvic floor. Whoop-de-doo, right? But again, that's what works for me. It doesn't have to work for everybody. As far as like long-term dating, I would say, or like dealing with this in the context of a relationship where you're not seeking a partner and you have to navigate that with like your baked in partner, for lack of a better term right now. um that's hard. It involves a lot of communication, and as women, especially if we're talking about women in relationships with heterosexual men, it's it's our job to do all the emotional labor. It's our job to go to therapy. It's our job to learn how to talk about our feelings. It's our job to even describe to men how they're feeling and educate them on that. And that gets fucking exhausting. So then it also becomes, if we're the person with lower libido, or we're the person with a pelvic floor hypertension or whatever, then it's our job to deal with that medically, and it's our job to explain that to them, and it's our job to apologize. If you can't read, I feel pretty resentful about this. There's a lot of like labor, invisible labor, that happens in heterosexual relationships, even if there is no pelvic floor dysfunction, that gets to be exhausting. And so like I think that's another thing that really negatively impacts relationships and can make them feel extremely exhausting, to the point where I'm doing all this invisible labor why would I want to have sex? Especially if like my partner's mm, their view of sex is so pinpointed on their fucking spotlight on their dick that that's the only sex that I'm expected to have. That gets to be really tiring. So I think a lot of that is like changing one's own scripts about what sex is and could be and kind of broadening that definition. But the hard part is educating our partners on that because that becomes our duty and that gets really old.
It sure
Sorry, I'm
does.
like dipping right into the resentment pool. Like,
No, no. This is definitely relatable. I have thoughts and feelings on both of those scenarios where, you're single and you're kind of navigating the dating thing, and
yeah,
you really want to feel that acceptance from someone when
right.
you tell them about your issue. But I used to view myself as broken when I was having my pain. So I was like, man, I just need to take what I can get. Like, I can,
Mm,
find some mediocre guy out there that'll deal
there's a
with
lot of
me. And it's just like, it's hard to reflect back on that and know that I had those thoughts.
them.
And yeah, I think there's just a lot of women with pelvic pain that are feeling similarly to that, where they're
Yes,
feeling like guilty or shame or just broken in general, like there's something wrong with you. Which it's like, sure, medically there is something wrong with you. Still kind of sounds bad, but it's like you still have so much to offer. And when I'm in
yes,
Facebook support groups and I see people saying like, "Oh, I think my husband's going to leave me," or like, "I can't like seem to find anybody who wants to date me." It's just like so devastating to read that stuff
yes.
because these people don't see like their value.
Correct. And it's like you get like minimized down to just a hole waiting to receive a penis, and that's really exhausting. And a turnoff. Why would you want to have sex if that's what it is? You know. But
Yeah.
you're right. The reality is what statistic? Take two. The statistic. It's like men are 7 times more likely to leave a woman who has a chronic health condition than the other way around. Like
Yeah, that's messed up.
that's a really hard thing to deal with in our culture and in our dating world right now is like recognizing too that like you need to be discerning when picking a partner and ensuring that your partner has the same is looking in the same direction as you as far as like how to manage chronic health conditions because they're going to come up. And I think that point of like being discerning is important. One cannot be discerning in their dating and try to pick the right partner for them when they feel guilty and when they feel worthless and indebted, right? You're more likely to just go for like whoever's there. And that like that sucks. That's really hard. I get why people are like, "Oh, who's going to want me?" Sure. Okay, like that's completely valid. And I also get why people are like, "Oh, men suck, like men are trash, whatever." I understand that. There hashtag not all men. I'm like there are good partners out there, right? But you have to be discerning and you need to like appreciate your single life too so that when somebody comes into your life, they add to it.
Yes, I love that. And I was
Yeah.
just thinking about like my relationships and navigating just the chronic side of things. And I think one issue that can be worked through in these scenarios is like the lack of education from the
Mhm.
partner's perspective. Because it's like,
Mhm.
okay, I can say that I have bladder pain, but that doesn't automatically like let them know that like sex might be painful, or like I feel like I didn't
Right.
always communicate as much as I could, but I also don't think it was my job to educate. I feel like the internet is there for a reason. Like I think it goes a long way if a partner, and if you're listening to this, good for you. I have lots of resources for you, but if you want to learn more, there is information out there where you could
Yes.
take the time to learn what your partner is going through and really be empathetic towards them and support them. And, this may be a long-term thing, it may be a short-term thing, but like, I mean, I feel like that's what relationships are about, like being there for each
Yes.
other no matter what.
Yes, and I think like a partner educating themselves on something about you, even if they're well intentioned, a little misguided too, and they're like, "Oh, have you tried Valium?" It's like, okay, buddy, like I appreciate the thought, right? Um, I think that that's a green flag in dating, right? Like, you're making me think, the last person I dated 2 years ago, we went out for a few months. He was like a Joe Rogan podcast listener, which I did not like. Um, and so I was just like, yeah, like you don't stop listening to it, but like, there's like some troubling things that are going on with that like, I have opinions about. I'm trying to be very measured and not just be like, what the, you know, and we talked about this like maybe a month after it was initially brought up, and I was like, did you ever like look into the concerns I have or like the things I'm saying? Because like if there's something you like listening to, don't you want to kind of like get into the dirt and like understand a little bit more? Like me listening to, like, Severance podcast. Um,
That podcast is really
I'm just like,
good.
give me more info, right? And like he never did. He was like, "Oh, why would I have done that?" And I was like, "Okay, so I didn't feel worth a 5-minute Google search." Like, that was the problem. It wasn't listening to the podcast. It wasn't like it wasn't really anything else, but I was like, I really don't appreciate the fact that like I didn't feel cared for in that moment. Somebody doing like a 5-minute Google search, I would feel like really cared for, right?
I feel like that
And
is
like,
so sweet. Like, yeah,
oh my
it's
god,
annoying
right?
if you tell me to like try something dumb, I'm gonna be like, no, I'm not doing that. But like also thank you.
Right, like just a little like, oh, I heard that you really like this, like I looked into it, or oh, I heard what you said about this, like I thought about it, or oh, you like this candy bar, here you go. Oh man, that's how you get me. So just stuff like that. It's like I think it's a show of effort. And so when we see our partners doing effort to try to understand what's going on with us, rather than just like continuing to cut and paste in all these sexuality boxes that we're stuck in culturally, like that feels really helpful and like a building block of a relationship with like mutual respect and care. Again, we don't have to look eye to eye on everything. There doesn't have to be like commonalities in everything. But I think somebody putting in some effort to try to understand, in the same way that we're putting in effort to like communicate and go to doctors and listen to this podcast and whatever, that goes a long way.
Yeah, it really does. I would love to hear your thoughts on how people who have the issues we're talking about, if they're in a relationship, like how do they effectively communicate about these issues? Like, do you have any tips or tricks for that?
So I really like this. This is a little bit different than what you're asking, but I really like Emily Nagoski. She wrote "Come as You Are." She
I knew
just
you were
released
going to bring
another
that
book.
up, and I'm glad you did.
Ah, hey. She released "Come Together." It's like the follow up to that, and it's about how to navigate libido differences in a relationship. So related, but a little different. But obviously, like, having pelvic stuff going on is going to affect your libido and your desire to connect sexually for sure. So it is relevant. Um, and in that, she talks about, uh, oh my god, my brain just totally did like a dump. She talks about like higher libido partners, which I found helpful. There's like some messaging directed at higher libido partners. I found that helpful because like I'm consistently the higher libido partner in all my relationships. So like reading that and learning about different ways to conceptualize sex helped, because there's these questions in it that are like, directed at the higher libido partner. Why do you want to have sex? Like, is it just about orgasming, or is it also about like feeling connected to your partner, feeling desirable, feeling wanted, feeling secure in your relationship, feeling like you have a future and you don't have to be scared? Like, listening to that and reading that and reflecting on that and like understanding that framework of how to conceptualize my own desire to have sex in relationships was helpful, because it helped me to mitigate and manage some of that scarcity that I feel around like sex, or if sex isn't happening in a relationship. And so I feel like using that framework to understand sex is very helpful, as well as like the other major point that she puts forth in that book, which is like pleasure being the measure. So like, maybe it's not about following the script that we established earlier, but rather about like talking to each other and understanding what gives us pleasure. Like, what do you find pleasurable? What do I find pleasurable? And then trying to figure out a way to like harness that and do pleasurable activities. And she likens it to like going to a party. So if my friend is throwing a party, day of the party, I'm like rotting, I'm in my pajamas, I'm like, oh my god, the party's at 7, I don't want to fucking get off the couch, oh my god. And like I dread it, and then I peel myself off and I fucking put on actual clothes, and that's pretty much all. Maybe I do a swipe of deodorant. And then I leave the house and I go to the party and I have a great time. Love the friend. Oh my god, food, what up? It's great. A little bit of conversation, there's some fun stuff going on. I go home and I'm like, wow, I'm so glad I did that. That was great. I knew I dreaded it before, and then I did it, and it was wonderful. And that is the measure, right? I went to the party, I had pleasure. And so, like, how can we harness that for sex in coupled relationships too, if there isn't a lot of desire there? Or maybe there's even dread, like in this party example, right? How can we acknowledge and, like, ensure that we're going to the party, having sex, that's going to be pleasurable and enjoyable, not painful, and then we're going to be glad that we did it?
Yeah.
Anyway, I really feel like that's a great way of framing communicating about it rather than just, oh my god, it's been a week, we haven't fucked, oh no, I have to do it, I have to do maintenance sex or he's going to be mad at me.
Yep, that is, I commonly hear that among
All the time.
people with IC and OAB and just all these issues, which is
Yeah,
hard. That's throwing your nervous system into fight or flight, and it's going to make you not want to have sex even more.
right.
Yeah. Okay, cool. I know you have to jump soon, but do
Yes.
you have any other, last minute things you wanted to say to anyone struggling right now?
I would say I understand that when you go to a doctor about this stuff, it's very medicalized and it's very scary. And you get this whole team of doctors, and then you get a referral to a doctor you don't fucking know, and a name, urogynecologist, what the hell is that? All this random stuff, and that's like super overwhelming. And like, I want to say there are people out there are therapists out there who have a whole hour to see you, aren't just doing a 15-minute appointment, where like they absolutely want to talk about this and get in the weeds with you. And like, that is such a great resource. I know that doctors don't often recommend that, or they do it in like a brush off way. Oh, it sounds like you have anxiety, like maybe you should go to therapy, or oh, how about you have a glass of wine? Fuck off. Like, there are therapists out there too who like want to get in the weeds, aren't embarrassed to talk about sex, and like can support and affirm you on this, because I firmly and fully believe like you are not broken. But sometimes it takes like some outside perspective and love and zooming out to like really begin to kind of capture that image of who you really are as a person and not just your pelvic floor.
Right. So if someone's like looking to find a therapist like you, obviously, you know, I'm going to talk about you in a second, but
Yeah.
is there a way to, like, is there any sort of database for people who work with people with sexuality type issues,
There's
or
like,
is,
I feel like there's people like the conferences or whatever that you could see. Like that's a good sign. Like Ishwish and whatever. ASECT is a good resource. The American Association of Sexuality oh my god, take two educators, counselors, and therapists. There's like a directory there. Um, or just more broadly, there are therapists who specialize in this. Like you can use Therapy Den or Psychology Today and use like the filters to kind of see if people might say like women's issues, oh my god, I hate that word, sorry, or anything else related to sex, that then you could find somebody who's kind of with it and gets it and wants to talk about it.
okay, cool. And
Yeah.
if somebody wants to work with you, which states can you to work with them in? And also, once you
Yes.
told me that if somebody, you don't see people in their state or you have a license, you're willing to get one. Is that still true?
Yeah. I love this job. I'm addicted to working, man. I mean, I have a few other providers who work with me now, which is really cool. Um, yeah, I work in Pennsylvania, New Jersey, Vermont, Florida, Colorado, and New Mexico right now. But, whatever, we'll figure it out.
All right,
Or,
awesome. I'll
at the very least, I can help somebody do a search to find a provider in their area.
True. You go above and
Yeah.
beyond. I'm going to put your links in the show notes so people can find you. But I just wanted to say thank you so much for coming on and having this chat with me. This has been super fun.
You're such a babe. I look forward to seeing you soon. Thanks for
I'll
having
see
me.
you in therapy. Wait, what does Squidward
I'll,
say?
I'll remember you all in therapy. Thanks, Plankton.
We're going to leave it at that.
See